things that I hear so much from parents is I'll always ask, what have you tried? What have we're talking about what's going on in some of the background. Well, what have you tried so far to fix it and work with them? And of course, talking to them and those things and having conversations. And we know a lot of times kids don't always want to hear it from their parents, which makes it tricky. But the other thing is, it's when they take them in somewhere, they're almost always told they're ADHD, they're on the spectrum, they need some type of medication. In probably 90% of the people that I talk to, that's the case. And some of them try it, and I think it helps. And some of them try it and their kids really don't like it or resist it. And then other parents are just like, hey, I'd rather try other things before we go all the way to medication. So for a parent who goes and has a sit down with a psychiatrist or whoever it may be, a doctor, and they want them to get on, Lexapro or whatever these other things that they have, they're like basically like Ritalin. What any type of advice would you offer these people? Because I am so resistant to it, because that's just how I was kind of raised and grew up, of like I barely can take an Advil, and I just kind of work through the pain if I have aches and pains and that kind of thing, because it kind of scares me. But what do you think? Because it does help some people. So what would just be kind of your 2 cents on
that situation? First of all, there is a time and place for medication. I am a PhD, not an MD, so I don't prescribe meds. And there's a reason why I didn't go to med school. But I think what's important to realize is you're going to get different responses according to who you see. So unrelated, but I used to be a physical therapist, right? And if someone had back pain and they went to see a physical therapist, a chiropractor, an acupuncturist, and an orthopedic surgeon, most likely there would be 4 different treatments for the same issue. Because that's the way people see things. So if you go see a psychiatrist or even a pediatrician, also an MD, statistically, it's more likely that they are going to prescribe medications, because that's how they see the solution.
Yeah.
Me, I've been totally vocal about this. My perspective and my experience and knowing what the research is that when we can get the skills-based learning, we can help a lot of people. That doesn't mean that there isn't a time and place for medication. It's just, you want to consider, who are you seeing? Because if you're seeing a psychiatrist, the majority of psychiatrists are going to prescribe medication. It's just the way that they view pathology and treatment.
Yeah. If you go to a surgeon, they're going to want to cut you.
Exactly. Yeah.